Hounsfield scale. Density of water 0, air -1000 Hounsfield unit, dense material bone 1000 Hounsfield unit. Values higher than 2000 Hounsfield unit, very dense materials, metallic dental fillings. By convention, the gray scale assigns higher Hounsfield values, lighter shades of gray, lower Hounsfield unit values, darker shades of gray. Window width assigns quantity of pixel values to grayscale. The window width determines the number quantity of Hounsfield units represented as shades of gray on a specific image. Selected range. The software assigns shades of gray to CT numbers that fall within the range selected. Value higher than selected range white, values lower than selected range black. Widening the width by increasing the window width, usually referring to as widening width. More numbers are assigned to each shades of gray. Scenario to demonstrate grayscale and window width. Assume that we have 10 shades of gray. We have selected 300 as our window width. Only 300 more than 2000 possible density values in our scale will be represented on the image as a shades of gray. All other will be either black or white. 30 different Hounsfield unit values will be grouped together and represented by each shade of gray in the image. If the window width is set at 300, which 300 Hounsfield unit values from all those possible will be shown. Now that we have selected the quantity of Hounsfield unit to be displayed by selecting the window width, we now need to determine the range of values to display. Window level, window center, determine the center pixel value in the grayscale. The window level selects which Hounsfield unit values are displayed as shades of gray. The window level select the center CT value of the window width. Select which Hounsfield unit numbers are displayed on the image. The particular Hounsfield unit value to be included in our image are entirely dependent on the window level selected. If 0 is chosen as the window level, the Hounsfield unit values that are represented as a shades of gray on this image will range from -150 to 150. Now assume the width stays unchanged at 300 but the center is moved to 200. Determining the range of Hounsfield unit values require only simple arithmetics. Divide the window width in half. Subtract the quotient from the window level to determine the lower limit of the range. Add the quotient to the window level to determine the upper limit. The new range of Hounsfield unit numbers to be included in the grayscale is from 50 to 350. Suggestions for setting window width and level. The software assigns shades of gray to CT numbers that fall within the range selected. Values higher than the selected range 350, then white. Values lower than the selected range 50, then black. Increase window width. If we increase the window width, a wider range of values will be included. In the grayscale range, more values will be assigned to each shades of gray. Widening the window width will include a wider range of values by placing more Hounsfield unit into each shade of gray. Window level setting. The window level should be set at a point that is roughly the same value as the average attenuation number of the tissue of interest. Example, a window level setting that is intended to display lung parenchyma will be -600 because air-filled lungs tissues measure around -600 Hounsfield unit. Windowing. The manipulation of window width and window level to optimize image contrast is referred to as windowing. Window width 500 to 2000 Hounsfield unit. Wide window widths are best for imaging tissue types that vary greatly when the goal is to see all of the various tissue on one image. Example, in lungs imaging, it is necessary to see low density lungs, parenchyma, as well as high density contrast enhanced vascular structures. Wider window width encompasses greater anatomic diversity, but subtle density discrimination is lost. Because wider window width setting decrease image contrast, this suppress the display of noise on an image. For this reason, wider the window width when patients are obese or when there are metallic artifacts. Lower or narrow window width tissue types with similar density should be displayed in a lower or narrow window width 50 to 500 Hounsfield unit. This approach is best in brain in which there is not as much variation in CT numbers. The values can be spread out over the available grayscale so that two tissues will only a small density difference will be assigned separate shades and can be differentiated by viewer. Narrow widths provide greater density discrimination and contrast. Narrow width in brain can differentiate the white and gray matter. Dual window setting, double window setting. Often systems provide the options of recording two different windows setting superimposed on one another in a single image because many professionals find the superimposition of images to be confusing and distracting. This technique is infrequently used.